they kind of forgot about the fact that Medicare is the single-payer option, and I actually believe that we ought to have Medicare for all, the improved Medicare for all, because as was mentioned, we got this Medicare disadvantage stuff that came in, and we got this Part D stuff that came in, which was basically a way to take money out of the taxpayer's pocket and give it to the pharmaceutical industry and give it to the private health insurance industry. So that Part D was written at midnight by the pharmaceutical industry, and drugs cost about 3 or 4 times what it costs to get those same drugs through the VA, for instance, which is another government program. And guess what? We do have socialized medicine in this country. There's only one place you can go for socialized medicine in this country, and it's the same place where John McCain goes for his health care, because it's the VA. Socialized medicine means that the government gets the taxpayers' money and pays for the care, and it owns the delivery system, which is the VA hospitals and all the doctors who are on salary. So we got socialized medicine, it's the VA. See whether the vets want to give up the VA, okay? So when we talk about Medicare for all, this is another myth. Is it socialized medicine? Absolutely not. Medicare is publicly funded, privately delivered health care. I was a non-profit doc out in practice. 70% of the hospitals in this country are non-profit. But then something happened along about 20 years ago where the profit motive got introduced into medicine. And the real question that we have to ask ourselves is health care in this country a human right?
Yes. Let me hear you. Is health care a human right? Yes. It's a moral right.
That's right. So what we're talking about here is we're talking about 2 issues. We have healthcare as a moral issue, a values discussion, and it's also an economic issue. And we have to decide in this country whether we think that healthcare is a right and is foundational for a civil society, and that it's something that we all want to contribute so that our businesses are freed up from having to spend their time being healthcare delivery agents, and they can make cars instead. Why do you think we're all bailing out GM and all the other car industries? It's because there's $1,500 worth of healthcare in every car that you buy. You think Toyota has to do that? Of course not. The Japanese all have universal healthcare. In fact, we are the only one of the 19 industrialized countries in the world that does not have universal healthcare. We also rank 37th in healthcare statistics. We die sooner. We have higher morbidity of deaths of women in childbirth. We have higher infant deaths. I mean, it just goes on and on and on. We do not have the best healthcare system that we could have.
Well, we pay the most.
We pay twice as much per capita for our healthcare as the next industrialized country pay. So my real question when I thought about this is, why am I here talking to the choir? Because you guys are all the choir, you know? I have 100 stories I can tell about my patients who got screwed by their health insurance, who got rejected because they had a prior existing condition, who lost their health insurance and lost their house. I mean, I got enough stories that you could get blood from a stone. And I'm sure that every one of you here probably has a story that you can tell about some healthcare horror. So, why are we talking to the choir? Well, I think that right now what we're doing is we're fighting a rearguard action for this bill that's coming out of the Tri-Committee. We have a bill coming out that unfortunately is doomed to fail. Even if they pass a good bill, it has no cost controls. It will not bend the cost curve. It will not cover everybody in this country. And so we have to decide at this point, are we going to just keep compromising? We've got the Senate Finance Committee. So the bill coming out is called 3200, and it's the Tri-Committee bill. And it right now has a public option, except that most most of the public can't actually use the public option. And most people are going to be stuck using private health insurance. That's the whole goal, is to keep the private health insurance alive. And somebody here talked about bailing out so what's happening with the public option is that we're basically agreeing to take money out of the taxpayer's pocket and put it into the health insurance pocket. And 30% of the healthcare dollar does not pay for healthcare. It pays for three things. It pays for CEO salaries. So the president of Aetna took home $16 million the year that he was bundling my codes and not paying me for my care. Okay, the profit margin in healthcare and pharmaceuticals is very good, so it goes to stockholder profits, and it goes to what's called administrative complexity. That's where we save the $400 billion if we go ahead and do Medicare for all. The minute we put that into place, we save $400 billion a year, every year. Why? Because Lurla and I don't have to deal with 15,000 private health insurance agencies. The 7,000 people who put those phony Medicare Advantage programs up go away. The Part D donut hole goes away. And all of a sudden, life becomes a whole lot simpler in your doctor's office. Their overhead goes way down, and costs can come way down. So that's why I have been, for 29 years, a single-payer supporter, and I hope to heck I don't have to retire without getting single-payer. The only way we're getting anything decent is that we have to have a rising up of the people in this country, because right now the health insurance industry is spending $1.4 million a day to defeat any kind of health reform. We're not talking about compromise. They are talking about kill this in the cradle. They're talking about ruin Obama's, 4 years. They're talking about bailing out the health insurance industry if they do anything. They are not talking about what this country needs. The only way we get what the people in this country need is if 1.4 million voices a day, email, fax, sit in, visit, call, whatever it takes. 13 doctors and healthcare providers got arrested in the Senate. If you remember, they're called the Bacchus 13. I think we need 1,300 people getting arrested. Doctors, most of them, probably wouldn't hurt, on the steps, because there is just no excuse for our elected representatives not to listen to the voice of the people. 60% of us support Medicare for all. Heck, 59% of doctors support Medicare for all. So I really appreciate you all being out here, and I'm sorry, you're not the ones we need to talk to. You got to go home and talk to your neighbors, talk to the Tea Party people. I had a really interesting conversation with one of the Tea Party people at the Watermelon Festival, and he was right on. He's really worried that this is going to cost us too much, and he's right, it is. If we don't do it right, it is going to cost too much, and we need to get our Republican friends, our fiscally conservative people, we need to get our blue dog Democrats to wake up, and we need to support our liberal people like President Obama, who was a single-payer supporter in 2003. I haven't given up hope. If the people of this country rise up, he will sign the bill.
Thank you, Dr. Susan Miller. Now, one of the interesting things that is happening in Congress that everybody needs to know about, and we may be the only place you're ever going to hear about it, is H.R. 676, or Expanded and Improved Medicare for All, is on the table, even though everybody told us it would never make it out of committee. There will be a motion. There will be an amendment by Representative Anthony Weiner of New York to replace H.R. 3200 with H.R. 676. All right? It is going on the table, and there will be a full debate on the benefits of H.R. 676.